If you want to learn everything you need to know as a nurse about pulmonary overinflation syndrome, then this is the video for you. Pulmonary overinflation syndrome is a group of diseases that occur as a result of lung overexpansion or barotrauma. When the lungs are overexpanded, the alveoli, the smallest unit of the lungs involved in gas exchange, and the capillaries surrounding them can rupture. Ruptured alveoli create a passage through which air involved in ventilation can leak out into surrounding tissue. This most commonly results in a pneumomediastinum. From there, the air can track up to the neck, resulting in subcutaneous emphysema, or down into the abdominal cavity, resulting in a pneumoperitoneum. However, air can also leak into the pleural space, although more rare, and cause a pneumothorax or tension pneumothorax, which can then subsequently cause respiratory failure and cardiovascular collapse. Additionally, air can leak into ruptured alveolar capillaries, resulting in an arterial gas embolism. An arterial gas embolism is another dangerous complication, as it can result in an inadequate supply of oxygenated blood to various tissues, also known as ischemia. If you want to learn more about arterial gas emboli, then click the link on screen or in the description down below. Pulmonary overinflation syndrome can be caused by positive end expiratory pressure, also known as PEEP, provided during mechanical ventilation, and as a complication during the ascent portion of a dive. During the ascent portion of a dive, atmospheric pressure, or the weight of the atmosphere, decreases. As atmospheric pressure decreases, the volume of gas occupies increases. For example, 6 liters of air at a depth of 10 meters doubles in volume to 12 liters at the surface. Therefore, if air becomes trapped within the lungs during ascent to the surface due to an anatomical abnormality, pulmonary secretions, or breath holding, it can result in pulmonary overinflation syndrome. Diseases that increase the risk of developing pulmonary overinflation syndrome include chronic obstructive pulmonary disease, also known as COPD, and asthma. Signs and symptoms of pulmonary overinflation syndrome are mild if a pneumomediastinum, pneumoperitoneum, or subcutaneous emphysema develop. This can include chest or neck pain, shortness of breath or dyspnea, cough, voice hoarseness, difficulty swallowing or dysphagia, and a crepitus or crackling sensation under the skin. However, if a pneumothorax or tension pneumothorax develop, signs and symptoms are generally more severe. This can include unilateral decrease in breath sounds when auscultating, asymmetrical chest movement, tracheal deviation, chest pain, hemoptysis, tachycardia, and varying degrees of respiratory distress or failure, such as shortness of breath or dyspnea, tachypnea, and poor oxygenation or cyanosis, and circulatory failure, such as hypotension, dangerous arrhythmias, loss of consciousness, and cardiac arrest. And finally, if an arterial gas embolism occurs, signs and symptoms are based on the site of embolization, but are most commonly stroke or myocardial infarct-like. Diagnosis of pulmonary overinflation syndrome includes a history and physical exam, X-ray or CT scan to assess for pneumos and subcutaneous emphysema, general blood work, including an arterial blood gas, and an ECG to assess for arrhythmias and myocardial ischemia. Treatment of pulmonary overinflation syndrome includes early intervention to decrease morbidity and mortality. Additionally, stabilization of airway, breathing, and circulation, also known as the ABCs, is important, as these patients can present in critical condition. Airway and breathing stabilization ranges from supplemental oxygen to mechanical ventilation, whereas circulation stabilization ranges from intravenous fluids to pressors and CPR. Furthermore, those with a large pneumothorax or a tension pneumothorax will require a chest tube. However, small pneumothoraces, or those with a pneumomediastinum, pneumoperitoneum, or subcutaneous emphysema generally require no treatment, or 100% oxygen can be given to assist the body with gas reabsorption. And finally, treatment of an arterial gas embolism involves recompression therapy in a hyperbaric oxygen chamber. Prevention of pulmonary overinflation syndrome during mechanical ventilation includes close monitoring of peak inspiratory and plateau pressures, whereas prevention during diving includes avoiding the activity if at risk due to lung disease and remembering to breathe during ascent. This wraps up everything you need to know as a nurse about pulmonary overinflation syndrome. I hope you found this video useful, and if you did, please show your support by giving this video a thumbs up, subscribe, and hit that notification bell so you never miss a video. And please leave a comment down below if you have any video requests. Thank you, and bye!